Hello everyone, welcome back to Expert Medical Coding. In today's video, we'll be discussing the HIV guidelines from ICD-10-CM Chapter specific guidelines. This is an important area that every medical coder should be familiar with. So, let's get started with HIV guidelines. Let me first read the guideline and then we'll discuss it in more detail. Let's begin with the first important guideline, and that is code only confirmed cases. Code only confirmed cases of HIV infection illness. This is an exception to the hospital inpatient guideline, section 2H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV related illness is sufficient. Now that we have read the guideline, let's break it down and understand what it really means. So the guideline states here, only confirmed cases of HIV infection or HIV related illness should be coded. But wait, what does confirmed mean here? Do we need a positive lab result or a culture result? The answer is no, we do not need a positive lab test or a culture result. In ICD-10-CM, confirmation does not require lab result or test reports. Instead, confirmation is based on the provider's diagnostic statement. Let's see an example now. The provider diagnosed the condition as asymptomatic HIV infection. So this is a confirmed case, so you can code Z21 asymptomatic HIV infection status. You do not need a lab report or a culture result to confirm this diagnosis. The provider's diagnostic statement is sufficient to code. Let's see another example. Provider diagnosed the condition as pneumonia due to HIV. This is HIV related illness, so you can code B20. No lab results or culture is required. The provider's diagnostic statement or the documentation is sufficient to code. So whether you're coding Z21 or B20, remember this. The provider's words are your confirmation. You don't need to look for lab results or culture reports to assign the code. Now here's the important part, what you should not code. If the documentation says suspected HIV, possible HIV, probable HIV or rule out HIV, you do not assign HIV code here. So these are not the confirmed cases, so you skip coding HIV in those situations. This makes the HIV coding an exception to the general inpatient guideline, where normally you can code probable suspected conditions. But here with HIV, that rule doesn't apply. So let's see an example. Let's meet Diana. So Diana comes to the clinic and her doctor writes in the notes as patient is HIV positive. Now notice something important. There's no lab report attached, no culture results in the chart, but that's okay. In ICD-10-CM, the provider's documentation is enough. The statement patient is HIV positive is considered confirmed. So for Diana, if she has no symptoms, you can assign code Z21, asymptomatic HIV infection status. Now let's look at another patient, David. His provider documents pneumonia due to HIV. Again, we don't need a lab report here either. The provider's diagnostic statement is sufficient. For David, the correct code is B20, HIV disease followed by code for the pneumonia. But what if the provider writes rule out HIV or possible HIV? That's different. They are not confirmed, so you do not assign any HIV code in those cases. Let's quickly recap the key points here. You only code confirmed HIV. Confirmation is based on the provider's statement, not the lab proof. Never code suspected or possible cases for HIV. Now let's move on to the next coding guideline, selection and sequencing of HIV codes. First, I'll read the guideline and afterwards we'll break it down step by step with practical examples. So let me read the guideline now. And it says, patient admitted for HIV related condition. If a patient is admitted for an HIV related condition, the principal diagnosis should be B20, followed by additional diagnosis codes for all reported HIV related conditions. An exception to this guideline is if the reason for admission is hemolytic uremic syndrome associated with HIV disease, assign code D59.31, infection associated hemolytic uremic syndrome, followed by the code B20. Now let us understand this in a more better way. If a patient is admitted for an HIV related condition, the principal diagnosis will be B20. Then you can assign additional codes for all the reported HIV related conditions. Now, why this is important? The principal diagnosis is the main condition responsible for the patient's admission to the hospital. When a patient has an HIV related illness, HIV is considered the underlying cause driving that condition. That's why B20 always comes first, followed by the specific illnesses like pneumonia, like Kaposi's sarcoma or candidiasis. But there is one exception. If the reason for admission is hemolytic uremic syndrome associated with HIV disease, you do not code B20 first. Instead, you code D59.31 infection associated hemolytic uremic syndrome as the principal diagnosis, followed by the code for B20 as secondary diagnosis. Let's see an example. Let's meet John. John has HIV and he comes to the hospital because he has developed pneumonia, and the provider documents as pneumonia due to HIV. Now, according to our guideline, principal diagnosis will be B20, HIV disease, followed by that secondary code is J18.9, pneumonia unspecified organism. Why? Because HIV is driving the pneumonia. Without HIV, the pneumonia wouldn't have developed in this way. So that's why B20 comes first. Another day, John comes in with Kaposi's sarcoma due to HIV. Again, the principal diagnosis we have to give as B20 and the secondary diagnosis will be C46.9, that is Kaposi's sarcoma. Same rule applies here. HIV is the underlying cause, so B20 comes first and secondary as the Kaposi's sarcoma. Now let us see for the exception. Exception is hemolytic uremic syndrome. Let's see an example. Let's meet James here. James admitted for hemolytic uremic syndrome associated with HIV. Then you code it differently. In this case, you will be coding principal diagnosis as D59.31 infection associated hemolytic uremic syndrome, followed by that secondary code as B20 HIV disease. So for HUS linked with HIV, you put D59.31 first, then B20. So here is a quick summary. If the admission is for any HIV related illness, assign B20 first. Then list out the related conditions as additional codes. The only exception is if the admission is for hemolytic uremic syndrome associated with HIV, you code D59.31 first, followed by that B20 as a secondary code. Now, let's move on to the next HIV coding guideline. This one is about what to do when a patient with HIV disease is admitted for unrelated condition. If a patient with HIV disease is admitted for an unrelated condition such as traumatic injury, the code for the unrelated condition should be the principal diagnosis. Other diagnosis would be B20 followed by additional diagnosis codes for all the reported HIV related condition. Okay, so let's break this down. If a person has HIV disease, but the reason they are admitted is something else like a fracture, appendicitis, or even an accident or injury, so then that condition is coded as the principal diagnosis. After that, we still need to capture the fact that the patient is having HIV disease, so we need to assign B20 as an additional diagnosis. And of course, if there are other HIV related illnesses documented, we code those too. Let's see an example. Let's meet Jacob here. So Jacob, who has HIV disease, is admitted to the hospital after a car accident with a fractured elbow. So the main reason here for the admission is fractured elbow. So the fracture code is the principal diagnosis. Then we code B20 HIV disease as a secondary diagnosis. So if Jacob also had, say, like HIV related pneumonia, we would code that pneumonia too. In short, the patient's HIV is not the reason for admission. You don't put HIV first. You put the actual reason for admission first and then the HIV disease as a secondary code, and don't forget any additional HIV related illnesses. Alright, so let's move on to the next HIV guideline. This one talks about whether the patient is newly diagnosed with HIV or not. Whether the patient is newly diagnosed or has had previous admissions encounters for HIV conditions is irrelevant to the sequencing decision. That means it doesn't matter if this is the very first time the patient is diagnosed with HIV or if they have been admitted before for HIV related conditions. The sequencing rules we already learned about, principal diagnosis and secondary diagnosis, stay exactly the same. Let's say an example. Let's say John comes to the hospital with HIV related pneumonia, and this is the very first time doctor discovers that he has HIV. Even though it's a new diagnosis, the sequencing stays the same. B20 first and J18.9 as secondary. Now let's talk about another case. David has been living with HIV for the last 5 years. He's admitted with Kaposi's sarcoma. And here also sequencing stays the same. B20 HIV disease as a principal diagnosis and code for the Kaposi's sarcoma is reported as an additional diagnosis. So the rule is simple. Newly diagnosed or long-term HIV patient, sequencing does not change. So okay friends, let's move on to the next HIV guideline. This one is about coding for asymptomatic HIV infection. Let me read the guideline first. Z21 asymptomatic HIV infection status is to be applied when the patient without any documentation of symptoms is listed as being HIV positive, non-HIV, HIV test positive or similar terminology. Do not use this code if the term AIDS or HIV disease is used, or if the patient is treated for any HIV related illness or is described as having any conditions resulting from his/her HIV positive status. In those cases, B20 should be coded. So let's make this simple. If the provider documents that the patient is HIV positive, but the patient has no symptoms, no AIDS, and no HIV related conditions, we quote Z21. But if the provider uses the terms AIDS or HIV disease, or if the patient has any HIV related illnesses, then we must use B20 instead of Z21. Let's see an example now. Example 1. Maria comes in for a routine checkup. Provider documents patient is HIV positive. No symptoms, no HIV related conditions. So we have to code it as Z21, asymptomatic HIV infection status. Let us see another example. For patient David, provider documents as HIV disease with oral thrush. Here symptoms are present and also documented as HIV disease. So we have to code B20, HIV disease plus additional code for oral candidiasis. Now let's see another example where John is documented as AIDS patient. Even if no symptoms are listed in this encounter, the word AIDS itself means HIV disease. So we have to code B20 HIV disease code. So here's the golden rule for this guideline. HIV positive, known HIV, HIV test positive or similar terminology, and no symptoms, we have to code it as Z21. AIDS, HIV disease or HIV related illnesses, we have to code it as B20. Now, let's talk about another important guideline. What if the patient's HIV test results are not clear? That's where the code R75 comes in. Let me read the guideline. Patients with inconclusive HIV serology but no definitive diagnosis or manifestations of the illness may be assigned code R75, inconclusive laboratory evidence of HIV. Okay, let's break it down now. So sometimes a patient's HIV test is done, but the result is not clear. Maybe the test shows something suspicious, but it doesn't confirm HIV. In that case, we do not use Z21 or B20. We use a special code R75, inconclusive laboratory evidence of HIV. Let us see an example here. Patient's first HIV test comes back positive, but the follow-up confirmatory test is negative. The provider writes inconclusive HIV serology. So we have to code it as R75. Here is the key takeaway. Use R75 only when the HIV test is inconclusive. Do not use Z21 or B20 unless the provider clearly documents HIV positive, HIV disease or related conditions. Alright friends, so let's look at another key rule from the HIV guidelines. This one is about patients who already had an HIV related illness in the past. So let me read the guideline. Previously diagnosed HIV related illnesses. Patient with any known prior diagnosis of an HIV related illness should be coded to B20. Once a patient has developed an HIV related illness, the patient should always be assigned code B20 on every subsequent encounter. Patients previously diagnosed with HIV illness B20 should never be assigned to R75 or Z21. Okay, here is the rule. So once a patient has developed an HIV related illness like HIV related pneumonia, HIV related Kaposi sarcoma or any other HIV related complication, that patient will always be coded as B20 HIV disease from that point forward. It doesn't matter if they come back later for a broken arm, a fever, or even if they have no symptoms during a visit. Once B20 means always B20. So let's take an example. John was diagnosed last year with HIV related pneumonia. Now today he comes to the hospital for a routine checkup and he has no active symptoms right now. So the question here is, do we code Z21 or do we code R75 or do we code B20? And the answer here is we have to code B20 HIV disease because the patient had an HIV related illness in the past. Let's see in another case. John with Kaposi sarcoma due to HIV is admitted for a fall injury. Even though the visit is for the injury, we must still report B20 along with the injury code. It's like a one-way door. Once the patient enters HIV disease status, they never go back. So the golden rule here is once a patient has HIV related illness, always code B20, never go back and code Z21 or R75. Every future encounter should be B20 only, no matter the reason for the visit is. Now, let's talk about what happens when HIV infection is coded during pregnancy, childbirth or the puerperium. This is a high priority area in coding because Chapter 15 pregnancy related codes always take sequencing priority. Let me read the guideline now. HIV infection in pregnancy, childbirth and the puerperium. During pregnancy, childbirth and puerperium, a patient admitted because of an HIV related illness should receive a principal diagnosis code of O98.7 human immunodeficiency disease complicating pregnancy, childbirth or puerperium, followed by the code of B20 and the codes for the HIV related illnesses. Codes from Chapter 15 always take sequencing priority. Patient with asymptomatic HIV infection status admitted during pregnancy, childbirth or puerperium should receive codes of O98.7 and Z21. Here is the guideline. If a patient is admitted during pregnancy, delivery or postpartum with an HIV related illness, you do not start with B20. Instead, you begin with O98.7, HIV disease complicating pregnancy, childbirth or the puerperium. After that, you have to code B20 and then the specific HIV related conditions like pneumonia, candidiasis, Kaposi's sarcoma. Why? Because chapter 15 codes always come first when pregnancy is involved. HIV with related illness in pregnancy. Let's take an example. Jennifer is 28 weeks pregnant and admitted with HIV related pneumonia. How do we code this? So we have to first code O98.7 HIV complicating pregnancy. Next we have to code B20 HIV disease. Then we have to code for pneumonia. So the pregnancy complication comes first, then HIV disease, then the illness. Now another case. Rachel is pregnant and her record says she is HIV positive but asymptomatic. How do we code this? First we have to code O98.7 HIV complicating pregnancy. Then we have to code Z21 asymptomatic HIV status. Notice here we didn't use B20 because she has no HIV related illnesses. So here is the quick memory trick. Pregnancy always puts O98.7 first, then add B20 if there's an HIV illness or add Z21 if the patient is asymptomatic. Think of it like this. Pregnancy takes the driver's seat and HIV takes the passenger seat. Alright friends, now let's move to very important coding situation. What if the patient comes in just for HIV testing? Do we code HIV disease? Do we wait for the results? So let's break it down. Let me read the guideline first. Encounter for testing for HIV. If the patient is being seen to determine his/her HIV status, use code Z11.4. Encounter for screening for HIV. Use additional codes for any associated high-risk behavior if applicable. If a patient with signs or symptoms is being seen for HIV testing, code the signs and symptoms. An additional counseling code Z71.7 HIV counseling may be used if counseling is provided during the encounter for the test. When a patient returns to be informed of his/her HIV test results and the test result is negative, use code Z71.7 counseling code. If the results are positive, see previous guideline and assign codes as appropriate. Now let us see it in more detail. So if a patient is being seen just to determine their HIV status, we use code Z11.4 encounter for screening for HIV. If the patient also has high-risk behaviors like IV drug use or risky sexual behavior, we add another code for that too. Let's see an example. Jessica comes in for a routine HIV test. She has no symptoms, just a regular screening. In that case, we'll be assigning Z11.4 encounter for screening for HIV. Now let us see another case. John comes in for an HIV test because he has weight loss and chronic diarrhea. Here, we do not have to start with Z11.4. Instead, we first code the symptoms, weight loss, diarrhea, etc. If counseling is done, we can also add Z71.7 HIV counseling. Now let us see returning for results. A patient named Emily comes back to the clinic to hear the HIV test results. She is not here for any treatment, just to know the outcome of the test. Case 1. Result is negative. The provider sits down with Emily and says your test came back as negative. Everything looks fine, but let's still talk about safe practices and HIV prevention. Since she's here to discuss results and gets counseling also, we have to assign the counseling code Z71.7 HIV counseling. Case 2. Result is positive. Now let's switch the outcome. The provider tells Emily your test results is positive for HIV. At this point, we cannot code Z71.7 alone. Instead, we go back to the earlier HIV coding guidelines. If Emily has no symptoms, we'll give Z21 asymptomatic HIV. If she already has an HIV related illness, we'll code it as B20 HIV disease. So Z11.4, use this when the patient comes for HIV screening. Z71.7, add this if counseling is provided during the visit. If the patient has symptoms, code the symptoms first, not the Z11.4. If the test result is negative, only counseling is provided, assign Z71.7 HIV counseling code. If the test result is positive, then follow HIV coding rules, Z21 or B20, depending on whether the patient is asymptomatic or symptomatic. Now let's look at the next important guideline, HIV managed by antiretroviral medication. Let me read the guideline first. HIV managed by antiretroviral medication. If a patient with documented HIV disease, HIV-related illness or AIDS is currently managed on antiretroviral medications, assign code B20 Code Z79.899. Other long-term drug therapy may be assigned as an additional code to identify the long-term use of antiretroviral medications. If a patient already has HIV disease, AIDS, or any HIV-related illnesses, and they are taking antiretroviral medications, you always code B20 HIV disease. But we don't stop there. We also add Z79.899 long-term drug therapy to show that the patient is on continuous treatment with these HIV medicines. If the patient has HIV disease and is on antiretroviral treatment, use code B20 plus Z79.899. If the patient is asymptomatic HIV and on ART, antiretroviral treatment, use code Z21 plus Z79.899. Now let us see the next guideline. Encounter for HIV prophylaxis measures. Let me read the guideline first. When a patient is seen for administration of pre-exposure prophylaxis medication for HIV, assign code Z29.81. Encounter for HIV pre-exposure prophylaxis. Pre-exposure prophylaxis is intended to prevent infection in people who are at risk for getting HIV through sex or injection drug use. Any risk factors for HIV should also be coded. Sometimes patients don't have HIV, but they are at risk of getting it. For example, maybe through unsafe sex or injection drug use. In these cases, doctors may prescribe PrEP, that is pre-exposure prophylaxis, medicines that help prevent HIV infection. So how do you code this? We have to assign code Z29.81 encounter for HIV pre-exposure prophylaxis. And here's the key point. If the patient has any risk factors like high risk sexual behavior or drug use, we also code those along with this Z29.81. Quick example. Let's say Maria comes in for her PrEP medication. She doesn't have HIV but she's at risk. The correct code is Z29.81, and if she has risk factors documented, we capture those too.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.